option may not be there, which I think it should be. I think there's still significant savings that are going to happen down the line because we're going to make it in their interest to help keep people healthy.
Tim, do you have a follow-up?
So that you would support it without the public option?
I don't want to, but I will. You know, if on balance, it has all of these other things in there. I mean, I don't want it to be a completely gutted bill and we just pass it so we can have a press conference saying, hey, we passed healthcare reform, great, and then it doesn't help anybody. We're getting the same problems that we have. So as long as all those other reforms are intact and there's a co-op, because I think we still need that competition in there for more choice for people to go and access healthcare. So the co-op's okay, public option is better, but I'm loose on that. I'm not married to it.
Congressman, as a follow-up to Tim's question, we've heard some discussion of triggers for a public option. Is that something that you would support in lieu of a public option, triggers down the road if the insurance companies do not if they do not become more competitive amongst each other? Would you support going to some kind of a trigger mechanism here?
Yeah, I would. I mean, I think it's public option. If not, a trigger several years down the line, and then if the savings aren't there, the trigger signals a public option, then goes into place, or a co-op. So, all of those, I think at some point give us some more choice. But, I think a trigger would be fine, and I think there's more debate going on about that in the Senate right now. As the gentleman said earlier, the student who spoke up, yeah, we have 60 votes, but we have Democratic senators from Nebraska, for example, from New Orleans, very conservative Democrats who, when you take a moderate Republican and conservative Democrat, there's not a whole lot of difference between the two. So those are the people that are going to be debating, I think, the trigger, the co-op, exactly what form this takes.
Nancy Himes. Nancy, could you go to the microphone, please? Nancy is a registered nurse. She lives in Girard. She's concerned about veterans and the health care that is or is not provided for their families. Nancy, your question, please.
My question is that all veterans, retired and disabled, will they be able to have free insurance for themselves and their family and their children because of what they've done for us to keep us free?
They will continue to be able to access the veterans health care system that they have. And we actually, I think a year or two ago, we put the greatest increase in the history of the VA into veterans health care benefits because we had all these Persian Gulf people coming online from '91 and then the latest in Iraq and Afghanistan. So we made a significant investment into veterans health care, and we will continue to do so. But this plan would be for everyone, for their families, for people who may not be able to access the veterans care, who have nowhere else to go. That's what this plan ideally is about.
Well, I did have a question also, and those families there, would they be able to get free insurance? A lot of times the wives are not able to work because they have to stay home with their husbands and take care of them. If they're not working, they're not able to have insurance.
It would depend, under the reform, it would depend on where they fall in the income category. So the veteran would be taken care of. But the spouse and the family now, all of a sudden, they would fall into this system, which I believe would be much better than the system that we have right now. And if they have, maybe I should talk just a second on how this whole thing's going to be set up. everyone's going to be in on the system now. And there'll be subsidies for people who make, families of four who make $88,000 a year or less will qualify for a credit, a health care credit or a subsidy that will help them pay for their health care. So this person, depending on how much they were getting in income a year, if they would fall into that category under the $88,000 a year, they would qualify for a subsidy. We will bump Medicaid up to 133% of poverty and strengthen it and give it more prescription drugs, and it will become better care. So that will go up, and then from 133% up to about 400% of poverty, which is $40,000 a year for one person or $88,000 for a family. then you would qualify for credit. So this person presumably would fall into that category where he or she would then, have some of their health care taken care of.
Thank you, Nancy.
And we can get into more of the details of the, of the plan as we chat,
Okay,
if that's okay, Bob.
that's fine. We have some time. Is Kathy Bergdorf with us tonight? Kathy? Kathy is owner of a healthcare business in Youngstown. She's for less government involvement and wants people to take their insurance with them when they change jobs. Kathy, your question, please.
Yes, we own a local business, and really we're dealing with the top 5 leading causes of death. As of January 1st, Medicare is proposing a 21% cut in reimbursement in those categories, and actually in cardiac and pulmonary it's a 70% cut. Wouldn't you consider that rationing of care, kind of like you were talking about the insurance company? If you have diabetes, we're not going to take you. Because really the hospitals and the physicians wouldn't be able to provide that care. It costs more to drive to work than the reimbursement we're going to receive. So would you consider that rationing?
Well, any system, there is some rationing, whether it's under the current insurance. I mean, you can't cover every single solitary thing. That's just not feasible. It's not, it just can't happen. That particular cut that you're talking about, we are going to fix. And we recognize that a lot of people have been taking a beating on Medicare reimbursements. And so that is something that needs to get fixed. But Medicare in general under this plan is going to get a lot stronger because we're going to, first of all, have a healthier, if everyone's covered, this is what a lot of seniors have been scared on this one too. They say, well, we're going to have cuts in Medicare. Okay, so seniors say, oh my God, you're going to cut my benefits. There are going to be savings in Medicare. And the problem we have now that's really driving up the cost of Medicare is we have, especially around here, we have a lot of people that are 50, 55, 60 years old, have lost their jobs and have lost their health care. And we had, we were doing these telephone town halls. We probably had 30,000 people on 3 of these calls. But I remember one lady in particular, she was 60 years old. She made $32,000 a year. She had health care, but her employer just got rid of it. And she said, I can't afford my health care. She makes $32,000 a year. She said, I'm just going to wait until I get into Medicare. And we have thousands and thousands and thousands of people across our country who are getting close to Medicare age who will not buy health insurance or have bad health insurance. They can't access prevention and all those good things. So they go into the Medicare program much sicker than they actually need to be because they don't have this care. So by having a healthier person, because under our plan everybody will have coverage, by having a healthier person going into the Medicare program, that will strengthen Medicare, that will save us a lot of money, and that will allow us to help with a lot of the reimbursements that people are concerned about.
So are you saying January 1st, the physicians and other ancillary providers were not going to be cut somewhere between 21 and 70% then?
Again, I don't say anything's 100% because that's not a smart thing to do. But yes, we have this problem every year where we have these cuts that are coming down the pike and we end up fixing them, whether it's with physicians or providers, wherever the case may be. So there will be some fix. I can't tell you exactly what it's going to be, but it won't be 21%.
Thank you, Kathy. Congressman, along that same line, talking about Medicare, the latest projections that I've seen over the weekend was that it's projected that Medicare will be belly up or close to belly up in the year 2017, which to my way of thinking is awfully soon. The savings that you were talking about to Kathy, would those kick in soon enough to help alleviate the shortfall for Medicare?
Yes, because people obviously as soon as we start this, people will immediately start getting care and then start getting into Medicare a little bit healthier. But there are also other savings that we're going to get. We had, just with Medicare Advantage, which we are not getting rid of, but we had we were going to save $117 billion